Can you guess what costs $150 billion and causes approximately 300,000 premature deaths in the U.S.? The answer would be obesity-related illnesses. My name is Angela Arturi, and I'm an RN. I work in a wound care center at St. Anthony Hospital. I see many chronic diseases directly related to obesity. Today I'm going to talk to you about the growing obesity epidemic in America and the implications that it has on our health and our future. Then we will discuss what can be done to prevent weight gain and promote weight loss. First, let's discuss the health effects of obesity. The American Action Coalition describes obesity to be a BMI of greater than 30. First, let's talk about how we can figure out our own BMI. You take your weight in pounds divided by your height in inches squared, then you multiply it by 703 and that will give you your BMI. For example, if we have a 210-pound person and say they're 5'8" or 68 inches tall, we'll multiply that by 703 and that will give us our BMI. So first, let's take 68 inches squared. So your answer would be 4,624. So we'll take 210 divided into that, and our answer is 0.045. And then we'll multiply that by 703. And our answer is 31.6, so we'll round up to 32. So this person's BMI that weighs 210 pounds and is 5'8" would be 32. So by the American standards, that would be considered obese. As I said earlier, there are many health implications directly related to obesity. Some examples of these would be high blood pressure, diabetes, liver disease, arthritis, and vascular disorders of the lower legs. I am currently a wound care nurse, like I mentioned, and I see many wounds that are directly related to obesity. For example, I see patients with decreased blood flow in their lower limbs. This can be caused by increased blood pressure on the femoral arteries, which are here and here. This increased pressure is from excess body tissue or adipose tissue that compresses these vessels and decreases the blood flow to the lower legs. I'm going to show you a couple of pictures of some examples of these wounds that can be caused. This one is an example of a blood flow disorder, of the decreased blood flow. The pigmentation is very dark and you can tell that there's not great blood flow. Normal tissue would be a nice pinker color. This is a very dark and dusky color. And this is an example of an ulcer that can develop from decreased blood flow. And then this as well is an example of a wound that can develop from decreased blood flow due to excess pressure on those femoral arteries. Now that we have discussed the health risks associated with obesity, let's discuss the implications that it has on our future. Obesity and the continuing epidemic can have many large implications on our future. For example, obesity-related illnesses are estimated to cost $344 billion by 2018. Another example would be how oftentimes children are diagnosed with juvenile diabetes or type 1 diabetes, and adults are diagnosed with type 2 diabetes, or also known as adult onset diabetes. We're now seeing more and more children that are being diagnosed with type 2 diabetes because of the increased obesity in children. Now that we know obesity can affect our future, let's look at what we can do to change it. There are many actions that we can take to stop this epidemic. One action is to exercise regularly. For example, exercising 3 times a week for 30 minutes a day. This can be done by walking, swimming, jogging, dancing. Studies have proven that exercising regularly decreases your chance for a heart attack by 50%. A balanced diet can also prevent obesity and promote weight loss. And no, not a balanced diet in McDonald's foods or things like that. A balanced diet with many fruits and vegetables and lean meats. A good thing to avoid would be greasy and fried foods. Weight management to prevent obesity isn't always easy, but it's very, very important. Today we have discussed the obesity epidemic in America, the implications that it has on our future and our health, and ways we can maintain a healthy weight and promote weight loss. So in conclusion, to stop this obesity epidemic, it must be a priority. This means giving up something we value for something we value more. For example, our health. Thank you.